Hello everybody, I'm Dr. Sanjay Pandey at the Kokila Dhirubhai Ambani Hospital in Mumbai. Interstitial cystitis bladder pain syndrome is a painful and agonizing disease, progressive in nature, for those individuals who go through the suffering of bladder being filled up with urine and getting a pain and discomfort that they can't hold. These patients are into a situation where the bladder lining is unfortunately undergoing a change. The change could be idiopathic, immunological, a distortion happening in the gag layer, which is bringing about a change of the entire bladder. These bladders go through a discomfort because as the gag layer or the inner lining layer is getting destroyed, not getting replenished, the bladder gets exposed to the solutes in the urine, basically potassium. The nerve endings which are now exposed are always getting touched by or getting infiltrated by the potassium ions, which cause a huge amount of discomfort as urine comes in contact beyond the urothelium into the lamina propria and the interstitium. And that's why that old terminology called interstitial cystitis. The new name of this terminology, which is chronic pelvic pressure or pain or discomfort that the patient feels when the bladder fills up, and therefore gets those symptoms of urgency, urge incontinence, pain while passing urine, pain even after passing urine, but majority of times relieved when the patient passes urine, is actually called bladder pain syndrome. And interstitial cystitis happens to be a phenotype or a domain within the bladder pain syndrome. These patients are of a large age group, anything between their 20s all the way to 60s and 70s. Predominantly in women. So women suffer from this disease where they cannot hold their urine, not because they have an urgency or frequency, they have actually a pain when they filled up their bladder. And as the bladder fills up, the discomfort increases. So many of these individuals have learned a forced frequency, a terminology which I described as patient cannot hold urine just because it's not urgency but because it's pain. These patients in full bladder will get up at night not because they have urgency but because they have pain which wakes them up and they rush and go to the washroom to empty the bladder. These patients cannot travel in lumpy bumpy roads of Mumbai and various suburban cities in an auto rickshaw because the bladder being full and being moved around will give them discomfort. These women are in the prime of their lives. They are working ladies or they are housewives. They get flared if there is a UTI. UTI sadly is not uncommon to women, and urinary tract infection can actually worsen the whole phenomena or actually flare up the phenomena of interstitial cystitis bladder pain syndrome. Many of these women go through a cycle of remission, another exacerbation and remission. And the exacerbations can be brought about by various stresses which they go through their life. It could be a physical stress, a mental stress, oral contraceptive pills, it could be a stress of life, it could be heavy physical activity, it could be urinary tract infection, which is more common. So changes in the menstrual cycle brings about a stress to the physical nature of the pelvis. It brings about exacerbation of the symptoms around, and patients go through the suffering for a long time. The exacerbated situation can be brought down to quiescence where they can have a better life. But frankly speaking, interstitial cystitis bladder pain syndrome is a progressive disease. It has got various phenotypes and patients present in different ways about only having a pain in pelvis, having a pain while passing urine, or pain is there all through the day, it's like a dull ache. Because it's in the pelvis, because it's in that region where the urinary bladder shares the pelvis with many other organs around, it can always be a confusable disease. And this has actually led us to a situation where we have missed out the diagnosis much earlier than we could have picked up. So the world now is much wiser in interstitial cystitis bladder pain syndrome. We look forward to these patients being identified early and not being treated wrongly as a recurrent UTI. The urinary tract infection in women can flare up interstitial cystitis. So many of these patients would deserve to be treated much earlier than they normally come to. To a urologist, they would come almost always late. Sadly, because the bladder is undergoing a change, many of these bladders can land up with a bladder fibrosis, a smaller bladder capacity. Partly because the interstitium is getting an inflammation called pancystitis, partly because the urine is infiltrating the lamina propria and interstitium, and there is that fibrosis being set up. So a subset of the patients may actually gradually lose their bladder capacity to a smaller bladder capacity. So imagine an adult producing 2.5 liters of urine and having a small bladder capacity of 50, 100 and 200 ml. She would land up passing urine with pain around 10 to 50 times a day. Her days and nights are in trouble because she's in the washroom. Such patients may land up even with catheter. That also would not give relief because the bladder itself is painful. So interstitial cystitis bladder pain syndrome is something which needs to be identified. It can only be happening if we probably will be able to spend more time talking to patients, understand their agony, and look at what flares them. Such patients get also flared by various food items, which includes dark chocolates, caffeine and caffeinated items around. So they normally avoid those foods. To a medical fraternity, it may look amusing because how can a food cause urinary issues around? But interstitial cystitis bladder pain syndrome is known to get aggravated by certain food items, basically the caffeinated drinks, the citrus foods, and probably dark chocolates. So these are things which patient possibly would avoid. We may not know it, but patient would say, these things would not help me, this will only aggravate my situation. In today's world, interstitial cystitis bladder pain syndrome has got a treatment. It has got a cure. There are patients who have done very well. The journey is long, and many patients who come late actually would require a replacement of the bladder called substitution cystoplasty, where we actually replace the entire bladder, which is a small capacity bladder right now, fibrosed, inflamed, giving only agony but nothing else, to a new bladder from intestinal segments. And this subject can now be approached robotically. Like we do robotic assisted techniques by using sigmoid segments and ileal segments, entire bladder can be created. A new bladder can be created by robotic assisted technique, where we don't have to go through the agony of a pain and a scar, and it could be a minimally invasive approach for many patients. The treatment of these patients deserves to be actually taken up at all levels, and therefore awareness of this in the medical community, awareness of this to gynecologists who see many of the female patients and to urologists is prime and important. We look forward to many more patients understanding this subject and taking it to the highest level.